Today, I'll be talking about what Duchenne muscular dystrophy, or DMD, is, what causes it, what the symptoms are, and what progress is being made towards finding treatments and a cure for DMD. Duchenne muscular dystrophy, or DMD, is a rare muscle disorder that affects approximately 1 in 3,500 male births worldwide, according to the National Organization for Rare Disorders, or NORD for short. DMD symptoms are caused by a near-complete lack of an important protein called dystrophin, required for proper muscle function, also according to NORD. My name is Wesley, and I was diagnosed with DMD around the age of 8. I am now 22 years old and have first-hand knowledge and experience with this debilitating and degenerative disorder. I will start by explaining what muscular dystrophy is, including DMD and what causes it. The Muscular Dystrophy Association, or MDA, describes the muscular dystrophies as genetic disorders characterized by progressive muscle wasting and weakness that begin with microscopic changes in the muscle. According to NORD, DMD is caused by mutations of the dystrophin gene on the short arm of the X chromosome. Who discovered Duchenne muscular dystrophy and when? DMD was discovered by French neurologist Guillaume Benjamin Armand Duchenne nearly 160 years ago, according to the Muscular Dystrophy Association. Now that we know what DMD is and what causes it, we will now discuss the signs and symptoms of it. There are numerous signs of DMD that usually start in early childhood, with symptoms also starting in childhood and continuing to get progressively worse throughout the life of the affected individual. Also, according to NORD, some of these signs include atrophy of the muscles closest to the trunk, such as those of the upper legs, pelvic area, upper arms, and shoulder area. Other muscles can appear disproportionately bulky. In addition, other signs include delays in reaching developmental milestones, unusual manners of walking such as waddling, difficulty rising from a sitting position, and repeated falling. Pseudohypertrophy in the calves is also seen. As the disease progresses, more and more symptoms will appear, with some becoming potentially life-threatening. According to NORD, more severe symptoms include progressive scoliosis, wasting of thigh and pectoral muscles, and abnormal fixation of the joints, also known as contractions. Other symptoms can include non-progressive learning disorders, attention deficit disorder, and autism spectrum disorder. Affected individuals will need wheelchairs full-time between ages 10 and 12, according to NORD. Life-threatening symptoms can include cardiomyopathy, resulting in less efficient blood flow, arrhythmias, and eventually heart failure. Also, deterioration of muscles in the rib cage can lead to respiratory infections, difficulty coughing, and respiratory failure, according to NORD. Despite the serious and potentially life-threatening complications of DMD, there is hope for affected individuals. Treatments to slow down progression of DMD and make affected individuals more comfortable include medical devices such as ankle-foot orthosis to slow contractions, wheelchairs, lifts, shower chairs, electronic beds, spine straightening surgery, heart medications to slow down deterioration of the heart, and assisted ventilation to combat respiratory failure, according to the Muscular Dystrophy Association. There are also experimental treatments aimed at restoring at least some dystrophin production in DMD patients to extend their lives. A potential treatment is the use of CRISPR-Cas9, CRISPR standing for clustered regularly interspaced short palindromic repeats, which is a genetic editing method. This method involves delivering a genetic editing to cells virally and has shown major potential. According to an article by The Scientist, this method was shown to improve dystrophin production in human cell samples, mice, and now canines. In the canine receiving the highest dose intravenously, dystrophin production increased by up to 70% of normal levels in skeletal muscle and 92% of normal levels in cardiac muscle after 8 weeks, according to The Scientist. Despite the seriousness of a fatal genetic disorder such as DMD, there is hope with various treatment options, including one that could restore dystrophin production in DMD patients. I am a sufferer of DMD, and I hope to see the CRISPR treatment extend the lives of, and maybe one day cure all DMD sufferers within my lifetime.